Hi everyone, welcome back to Group 21's 171 video. Today we'll be talking about crowdsourcing and healthcare prediction algorithms.
Hey everyone, it's Shannon, and today I'll be talking about crowdsourcing and algorithms.
First, what is crowdsourcing? As defined by the Merriam-Webster Dictionary, crowdsourcing is the process of obtaining needed services, ideas, or content by soliciting contributions from a large group of people, and especially from an online community rather than traditional employees or suppliers. As of recently, there has been a rapid growth in these systems because this process allows for the obtainment of massive labeled data at a low cost. However, the downside to this process is the variable uncertainty of crowdsourced labels. As a result, learning procedures become difficult. In order to improve this issue, two aspects play a key role: improving the qualities of labels and improving the quality of learning models. In our second article, it discusses the use of computer algorithms in a health setting. Currently, the use of algorithms have been so integrated that some are even being used to make complex decisions in lieu of humans. However, there are some downsides with using algorithms to make these decisions. For example, a software program that determines who gets access to high-risk healthcare management programs is said to exhibit racial bias, because it has consistently let healthier whites into the program over blacks who are less healthy. The issue with this lies in patient risk, because the algorithm determines who should have access based on how likely they are to benefit the program. For example, they considered the costs of the patient, and since cost is not race neutral, it ended up influencing the algorithm to become racially biased. Overall, I feel that although algorithms are helpful, it can potentially bring trouble in various ways. Algorithms calculate and determine based on logic, which, unlike humans, I feel there is no empathy when it comes to making decisions. For example, in a situation involving two people with varying backgrounds, algorithms will most likely consider factors it was programmed to consider over the actual levels of need for whatever the algorithm is for between the two individuals.
Hi everyone, my name is Livia Chimaki and I'm going to be talking about algorithms.
So first, let's begin by understanding what an algorithm is. It is a recipe or an instruction to solve a problem or complete a task. It is used in the healthcare system, banks, social media, government, and so many other fields. Anything people do or see online is because of algorithms. Algorithms have had many beneficial outcomes in different fields. Humans have limited potential by themselves. Algorithms are able to lead to better insight when it comes to solving a problem because they can show rationality. It is beneficial that these algorithms are mostly based on evidence and studies. They can also make sense of large amount of data that would be so difficult for humans to do without any help. Algorithms are also capable of speeding the process of a task that would take humans much longer to complete. However, there can be some cons to algorithms. For example, as more algorithms are created, less jobs can be available for people. There can also be unfair outcomes due to algorithm bias.
I'm Yuya, and I'm going to talk about the technology for the chronic health. I think prediction algorithm in healthcare system can be very useful to determine a million of patients in short amount period. However, it can change the outcome of result very easily with same question, but they are slightly different. It is important to think about how these slight changes in algorithm can be, can change the result of the prediction, as there were racial bias in a software program that black people had a significantly poor health score than white people. And as technology evolves, algorithm can be trained. I think the most important fact is that the software program can be trained and changed and reduce the racial bias at the end.
Hi, my name is Jaren Yang and I'll be talking about algorithm bias.
Computer algorithms are now making complicated decisions based on history and background, which has affected many people because of bias. The three categories of bias include racism, gender, and socioeconomic bias. An example of these bias include a software program that is allowing healthy white people over less healthy black people into a healthcare program. This bias is caused by the idea of patient risk, meaning that they choose candidates based on who would most likely benefit from the program. By taking gender, racial, and socioeconomic factors, they choose candidates that have the least risk and would not negatively affect the program.
My name is Anne, I'm going to talk about what we know about predictive algorithm.
The algorithms encode racial bias by using healthcare costs to determine patient risk, or who was most likely to benefit from care management programs. Because of the structural inequalities in our healthcare system, blacks at a given level of health end up generating lower costs than whites. As a result, black patients were much sicker at a given level of algorithm predicted risk. By tweaking the algorithm to use other variables to predict patient risk, such as costs that could be avoided by preventative care, more generally incorporating routine audits into algorithm developers' workflows would help. By correcting for the health disparities between blacks and whites, the researchers found that percentage of black people in the automatic enrollee group jumped from 18% to 47%. In order to be successful, we feel that clinical event prediction and subsequent intervention should be both content-driven and clinician-driven. Healthcare providers need to partner with groups that have a keen understanding of leading academic and commercial tools and the expertise to develop appropriate prediction models.